Hello, this is Anna Nanik, representing Group 26 as the Secretary of Health for our case study 2. Our case study indicates that on December 31st, 2019, China reported a cluster of cases of pneumonia in people associated with the Hunan seafood wholesale market in Wuhan, Hubei province. On January 7th, 2020, Chinese health authorities confirmed that this cluster was associated with novel coronavirus, 2019 novel COVID. Although cases were originally reported to be associated with the exposure in seafood market in Wuhan, current epidemiological data indicates that this is person-to-person transmission. As of January 30, 2020, a total of 9,976 cases have been reported in at least 21 countries, including the first confirmed case of 2019 novel COVID infection in the United States reported on January 20, 2020. And as of April 24th, over 2.7 million cases have been confirmed with over 194,000 deaths across 185 countries. As of June 5th, over 6.75 million cases have been confirmed with over 393,000 deaths across 210 countries. So as the Secretary of Health, it's important to address pertinent questions. First and foremost, the epidemiology of our COVID-19, specifically incidence and prevalence. We want to know how many people have it and how many people are getting COVID at what rate. So one indication or one very good website to turn to is coronavirus.jhu.edu/map.html. This will give us the idea of how fast COVID is spreading and how many people it's infecting. Another very important number is our infectivity rate, our basic reproductive number. Approximately, the WHO says that this number ranges from 2 to 4 as of right now. This is the ability of the virus to be transmitted. As you can see on the image on the right-hand side, it breaks down what the R value genuinely is. The higher it is, the more people you can affect by having COVID-19. Moreover, demographics. Men and females alike get COVID-19. It also affects people of all ages. However, when looking at fatality rate and risk factors, comorbid conditions and older age tends to drive a much more virulent, much more deadly virus. Fatality rate currently is approximately 5%. Moreover, we need to address the mode of transmission. So how is this virus transmitted? As we saw in our case report, it was person to person, but that doesn't mean we should just stop right there. We have to address the potential of it being transmitted via respiratory droplets, aerosols, direct contact, fomites, fecal oral, and even address the possibility of vertical transmission. Another question to ask is, what is the incubation period? So the CDC addresses that the incubation period is anywhere between 2 to 14 days, with a typical average rate of 5 days. What is the duration of infection? So 2 to 3 days becomes the onset of the infection. So in other words, you can become infected, transmit the infection, and not even have symptoms. The duration of the infection ceases typically between 8 days of the onset of symptoms. As a Secretary of Health, I need to figure out, do we get immunity after getting the virus? And do we have the possibility of reinfection? Some clinical features that people should look out for are fever, cough, shortness of breath, loss of smell and taste, fatigue, and headache. Also, we need to address what is the course of this virus. So mild, severe to critical. And are there any symptoms that happen post-infection? As of right now, we don't know much about COVID-19. So therefore, some of the measures that we can address are protecting ourselves and preventative measures. So for instance, general protective measures can be hand hygiene. When washing hands, make sure it's with soap and water and a certain disinfectant. Avoid touching your eyes, nose, and mouth. Respiratory hygiene, cough etiquette. So avoid coughing or sneezing in the direction of others. Use tissues. Used tissue should be discarded appropriately and hand washing should happen thus after. Maintain a 3 to 6 feet or arm's length distance from anybody that you come in contact with. And avoid any excess exposures like public transport, train station, airports, mass events. Avoid traveling to areas with significant outbreak. And follow any of your local agency and recommendations regarding any kind of attendance of events and gatherings. Another thing is mask wearing. General considerations include wearing any sort of face mask covering if you are in crowded areas. If you have a cloth face mask, the indications for CDC say that wear it in public places. If you're walking outdoors, it's not entirely necessary. Surgical masks should be worn in very crowded places, indoor malls, airports, large events like concerts. N95 should be indicated for healthcare workers or infected individuals that have to be provided health care. Exposure risk management. Make sure that we're social distancing. Make sure we have home isolation and quarantine whenever we have an indicated risk of exposure or a positive COVID test. With that being said, testing. What kinds of tests are there? There's the PCR, antigen, serological, and that can all just vary depending on availability. Who should get tested? All individuals with symptoms listed before should get tested for COVID. Any individuals with close contact or confirmed COVID-19 case and higher risk groups, such as patients who are currently getting treatment for cancer. Management at home for our citizens to understand if they're asymptomatic or mild cases. Minimize the spread is the most important thing. Make sure you're quarantining yourself and you're not risking exposure to other people. Make sure that management to close contacts occurs as well. But all in all, supportive care like rest, hydration, nutrition. Pharmacological treatments include antipyretic and anti-inflammatory therapy. Monitor your symptoms and watch out for red flag symptoms like shortness of breath. And discontinue home isolation after 8 days of onset of symptoms. Now, if any of the symptoms, you have red flag symptoms, make sure that you admit yourself or you call 911 and get proper adequate care. All in all, we want to make sure that aside from quarantining, that we're getting other preventative measures aside from masks as well, which are vaccines. We want to introduce vaccine sites to as many places as possible. Pfizer, Moderna, Johnson & Johnson are 3 main vaccine distributing pharmacological companies within the area. Make sure that you get them when you can. The first one, if there's a second one, and also the boosters. Overall goal is to make sure that we're flattening the curve, right? So efforts to prevent the spread and decrease our infectivity rate. Make sure that you're doing all said things I mentioned prior, like hand hygiene, wearing masks, social distancing when necessary, quarantining when necessary, and getting your vaccine in order to finally stop the spread of COVID-19 virus. And here are my references.